Medical care for 18,000 foster children in Illinois is at risk. That's according to the Cook County Public Guardian. He says it's due to a planned change in insurance coverage slated to happen in just a few weeks. CBS 2 political investigator Dana Kozlov live outside the Thompson Center. Dana, this has been an ongoing concern, but now there's a real deadline.
Yeah, Brad, there has been a concern about how this switch is going to affect all of those thousands of children in foster care, how it might limit their accessibility to doctors, some of these children who have many serious medical needs. It has been a fight going on now for almost a year to keep it from changing, and it continues.
I would say that my concerns have intensified given, the pandemic.
Grace Brown parents 7 children. 4 of them are foster kids. We met back in January when the state of Illinois was set to switch to a managed care health insurance plan for its 18,000 children in the foster system. Cook County's public guardian, Charles Golbert, flagged potential problems with the switch then.
It makes no sense.
He's even more worried now.
No matter how you slice and dice the results of this exercise, this is a mess for foster parents.
The new managed care plan is called Youth Care. The state is set to switch to it on September 1st. Last week, Goldberg wrote this letter to Governor J.B. Pritzker urging him to delay the rollout, citing an inaccurate doctor database, provider confusion, and coverage denials as reasons for his concern.
I think we're in big trouble on September 1st.
Attorney Brian Finley has reason to say that. He spent 30 hours over 8 days making calls to listed youth care family medicine doctors to find one that would see a fictional 10-year-old Vernon Hills boy. He says of the 108 listed youth care providers he called, only 7 said yes, they would accept a 10-year-old patient.
1 is they don't take youth care. 2, they've never heard of youth care. 3, they're retired, they've moved.
The director of Illinois' Department of Health Care and Family Services wrote back to Goldberg about his concerns. She said Finley conducted his search all wrong, defending the provider list and accessibility. But Grace Brown says the problems are real.
I'm not a secret shopper. I'm literally shopping for my children, and I'm finding the same things.
We're very concerned about this happening in 3 weeks. The state is so clearly not ready, and we're not going to let this go.
Not going to let this go. Charles Golbert says he is writing another letter to Governor J.B. Pritzker for reconsideration. He is also reaching out to lawmakers, and he says he has not ruled out a lawsuit. Brad?
Dana, concerning. We're obviously talking about our most fragile, whom we're responsible for. If it, as the Guardian said, makes no sense, why change?
Well, according to a press release released by the department back in July, this is supposed to actually enhance coverage opportunities, increase providers 3 times. That is a reason cited by the department. Of course, that is something that Goldberg does not agree with, and he is fighting. He believes it's all to save money. I reached out to a department spokesperson this afternoon to ask, well, is it saving money? And if so, how much? And I have yet to get an answer to that very specific question. Brad?
And that is a $64,000 question. Dana Kozlov, our political investigator, thank you.